Hi y'all, Gwen Baroud here again with Texans Defending Democracy in one of our mini Interview the Expert series. Today we have Laura Leeman, and I met her back in 2018, and you introduced yourself as a healthcare voter. And it just stuck with me. And the reason is you have been working tirelessly for your medically fragile son, and you have a long history of it. And um, you've spoken of that painful journey, and I'm going to let you tell your story on that. What got you, a little bit about you, and what got you to this point of being a healthcare voter or healthcare advocate?
Yes, thank you.
Mhm.
First of all, my family moved to Texas in 2015. When we were living in Washington State, it took us 8 years for my son to receive Medicaid. That was prior to the ACA, right? As well, when we moved to Texas, after we were able to get it for 1 year before we ended up moving to Texas. Then we
Oh,
moved here, and I had to start from scratch to apply from the very beginning, as if he were just born in Texas. So that was a lot of heavy work. It took several people to help me along that journey. And there are some interesting oddball things that goes along with trying to get those services. People just assume that every child or anyone who's disabled just can automatically get these services, and that's just not the case. So we had to go through a loophole situation in order to get Medicaid for my son. So my son, Victor, he was medically complex and disabled, intellectually, developmentally disabled, physically disabled. He was total care. And many of his, he had a long list of diagnoses, and epilepsy was the first thing that started with Victor when he was a baby. Epilepsy was one of the main things, the main criteria to to give us the opportunity to take advantage of a loophole. There were 3 different criteria that needed to be met, and I honestly can't remember what they were, but he definitely, he qualified for those. So what my husband had to do, or one of us had to do, was take my son to a nursing home where adults are. And in the middle of the night, he took him at 11 in the evening to be there just before midnight and then be able to be discharged a little bit after midnight. So he would qualify for 24 hours of receiving services in that setting in order for uh, the the state to say, okay, he needed to go to a facility and with nursing care. Therefore, now he is deemed able to get Medicaid. It was a very odd experience. One, my husband got lost. We hadn't lived here for very long after that, uh, learning that he had to go through that. And it's very different. We moved here in September, so it took several months for me to get everything together. So it was in 2016, and I learned from other families similar to ours that not everybody's experience was the same. So the list that we had at the time was a long list, and we just could pick any place, but we had to make a reservation with the facility, knowing that we would be coming. Okay. Now, where my son was taken to was quite a distance from our home. It was difficult to find the closest location. I learned that some families, depending on the location that you went to across the state, you had to either stay a full 24 hours actual, or you could just pop in kind of like we did and stay even less time than my son did. Okay. So that opened a huge door to getting the services that my son needed in order to cover his medical care costs, of course, as well as physical therapy, as well as his equipment and his medical supplies. My son
Yeah.
required a lot of different care. We literally had, it was a mini hospital that we were operating like, and that increased over his lifetime. So uh, going through that experience was so arduous, and but yet I also was so grateful. It also allowed us to get nursing services for Victor based on whatever, how many hours they deemed was appropriate. And at the time, we were receiving, I think it wasn't very many, um, based on his heavy care. I want to say it was like 30 or 40 hours a week. Uh,
Wow.
and we needed to spread that across 7 days, right? And so then that took us into understanding about the nursing system and home health care. Now, coming from out of state, while it was easier for us to finally get Medicaid out of state, um, we nursing care did not come with that. So I will say this, that, and and this might, other people who have lived here longer than I um, may have different opinions, but I was so grateful to be able to get nursing care as part of the
Yeah.
services. It was a huge, huge help. But along with that came a lot of other issues just around keeping nurses, which is basically a rotating door. Everybody who has to have and rely on home health nurses, it's a rotating door to keep people.
Hmm.
So there's that. But
Yeah.
that entire experience just shocked me. Also, while my son was receiving Medicaid, I was told that he would be able to receive that up until the age of 21. And other people would say, oh, he will qualify, he will get services at the age of, after the age of 21. Well, I never counted on that. And I will say that it was something that weighed on me every single day, knowing that at
Right.
some point it was going to expire, if you will. There's another waiver list that he was been on. It's called the class list. That's kind of like the golden, the holy grail, if you will, of getting services, because it opens the doors to kind of unlimited services. Now, I'm not, my son passed away a couple years ago, so we didn't get to that point. I don't know how it's functioning now, but as any parent in my position, we kind of have become the professional know-it-alls because you have to, right? There's just no
Right.
option. And I will say that one of the reasons that healthcare, I've always been supportive of universal healthcare. Before I even had kids and before I even got married, the concept made so much sense to me. Uh, it makes so much sense because everybody breathes in air. If you have a difficult time with breathing, like sometimes my son did, he required oxygen. So everybody needs the health care that they need, right? Everyone has a need, goes to some sort of physician at some point in their lifetime, many of us, many times over our lifetime. And it should not, in my opinion, ever be based on your class system. How much money you make. It should not depend on your
Right.
employer providing you health care, in my opinion. And I'm not the only one that thinks that way. So there are 70
Mm.
countries that have universal health care.
Right.
And when I was looking up before we started here today, I was doing a little research. Now, Russia happens to also have universal health care. That is something I learned a while ago. So I wanted to find out a little bit more about that. And their system, everyone gets universal health care, and they have been since 1996. And they have an option of getting using private care, likely for those who have more money, to so that it's better healthcare. But every single person, even someone who is not, who is not born in that country, they automatically, once they're there, they get healthcare.
Right.
I find that shocking given where we are.
So you had mentioned that you want, as far as like a universal health care, which is of course not an option here, but is of course in other countries.
Mhm.
I agree wholeheartedly because no family should have to go through what you did. In my line of work. I would see families having to jump through the hoops
Yeah.
or find loopholes to get the coverage that they needed for their child. So, yeah, it makes sense to get a universal plan. So, nobody who has a child that they want to give their child health care should have to go through these hoops.
Well, and
Yeah, thanks so much.
and sorry, just to say is that with the fact that the way our system is now, being that we don't have universal health care, is that I always kept thinking to myself, my gosh, as my son was aging, more things were coming up for him. And we were in the hospital more times than I can count. I don't know how many times we were in the hospital. I used to
Right,
know the date of all of his procedures at one point in time, and then I just couldn't. Um, but those were, I mean, he must have been millions of dollars, of needing assistance, especially if you're in the hospital, if you have surgery
right,
on top of that. And so there are families that don't have, like we had at least the luxury of having private insurance for the family, which he still used, but not everybody has that option. Um,
right,
so I always was thinking, my gosh, if we didn't have, if my husband didn't have this job that we were able to have these luxuries, because that's what
right.
healthcare is. It shouldn't be, it should just be,
Should,
but it
yeah,
is. And what would we do? And so
right,
in terms of becoming a healthcare voter, I've always paid attention to what's going on with healthcare. I've always believed I'm a dork. By the age of 18, I voted. I was excited to vote, and I've never stopped, and I've always
right.
voted. And when that campaign of healthcare voter kind of came on the scene in 2017, there was just no way that I wasn't going to be a part of that. So I am a long lifer of being a healthcare voter.
We need, well, yes, we need you in the fight. So tell me, okay, you were more than say a healthcare voter. You were a healthcare advocate. What can you tell us a little bit about your advocacy, what you did, how it helping folks navigate the system, other parents that are going through the same thing as you, or was there an organization that you were with?
So I just fell into the advocacy. Well, one, I was always advocating for Victor since the day
Mhm.
he was born. And I've always been someone that is thinking of others. So
Mhm.
it just kind of came naturally to me that if I'm going to speak up for my son, I'm going to include others with him because he's not alone. And I joined an organization in Texas, just kind of stumbled into it just as it was beginning. And it was organized by a couple of other moms. They didn't have, their kids didn't have the same level of needs that my son had, but they were just newly organizing themselves. And there was a meeting or a rally at the State House. So I took my son. We had a nurse at the time that came with me. We stayed in a hotel, and went to this rally, and we went around the different offices at the
Mhm.
state legislature, and it was amazing. And I had a team with me. I had the nurse, and two of my friends came also to come with me. And
Mhm.
so here we were, this little entourage, but there were all these other mini entourages also. There was a child that was there that was in a moving hospital bed. Like I was
Oh,
so
wow.
I just thought, holy moly, that is, because I know what it's like taking your kid who's in a wheelchair, loading him up, getting all the equipment. It's a lot of work. But
Yeah.
that just goes to show how much it is necessary, it is needed, right? Is all of these other families coming from different parts of the state of Texas showed up to go meet legislators, and not just our own, but many different legislators. Didn't matter what party they were affiliated with. I didn't care, because I just wanted someone who was going to listen and
Mhm.
take some action. But at the end of the day, literally at the end of that day, I thought, this is ridiculous. I am going door to door talking to people, which is great, but I'm not actually talking to the legislators. I'm talking with no disregard of the staffers, but it just it just hit me like I am repeating the same things over and over and over again, and I don't know where this is going to go. I don't know if anybody's going to care about this. After that, I ended up connecting with the leadership and said, I want to be a part of this. I will join this team. I will do whatever it needs for us to move forward and to make some serious legislation. Now, at that time, that is right after Texas privatized Medicaid. So the issue at that time was about the privatization. And the fact that there were, I probably assume at the time when you were teaching, Gwen, that that was also when people were losing therapy. There were big therapy cuts. So that's how I got involved. I just kind of jumped in. I would be up late in the evenings. I mean, talk about grassroots. It was grassroots. We were on the phone at 11 o'clock. I couldn't wait to get my kids to sleep so I can get on a call at 11 o'clock at night. And we would just talk about different legislative issues and healthcare and stuff like that. So I just I helped within an organization, but I was also reaching out to my elected officials directly. And I would bring my son with me as often as I could.
Yeah. So I have a question about that, because you said, of course, you had Medicaid services, but you also had private health care. Was that, because I remember when Victor was in the hospital quite often, you had actually had to travel to Pennsylvania where he was hospitalized there for, I'm guessing, because they specialized in a specific service. Is this something that was afforded through the Medicaid, or was it more afforded through the private care, your own, your husband's plan?
A lot of it was covered through Medicaid. So that was when we had a lot of long-term stays, but that was definitely the longest. That was in 2019. He had his lymphatic system was breaking down, and at the hospital where he was here in Texas, they had reached out to other hospitals, and they kind of maxed out on what they could do for Victor. So going to Philadelphia Children's Hospital, otherwise known as CHOP, was a kind of last resort option for us. I had to track a lot of things. Oh, gosh. Sorry, I'm not going to be very clear on this because that was so long ago. And
it's okay.
It was such a chaotic time that my mind was in a lot of different places. But yes, he did receive Medicaid during that period of time. And there was some point, I think, our insurance kicked in. I mean, we had to take like an emergency flight. Right. And that was a whole nother experience.
Well, let's go with that. Let's just talk about your frame of mind, your family's frame of mind. When that was going on, how were y'all dealing with that? Just let's take the insurance out. Let's take all of that out. What were you going through?
Hell.
I mean,
yeah, it was scary. It was very scary. I can't imagine. I witnessed a lot of things. I met people whose names I don't know, but you meet people when you're in the hospital. You get so to just kind of share a little bit about being in a hospital. you get to a point where with the drill, like I knew, okay, I knew something was going on with Victor at a given moment, and okay, I go into drill mode. This is what we do. I grab my binder of information that I'm going to have to download when I get to the hospital. Right, I'm going to be asked all the same questions, and even while I was, of course, I don't have it anymore, but I had like a sheet that I always had available to anybody that worked with my child in our home, available to them, all of his medications. And so I would just kind of pull that out of my binder, hand it over to whoever was the person coming in um, to check you in, if you will. It's not called check you in; it's something else. But
Yeah,
I'll use
like
the
register.
hotel version. And is they would ask you everything about what's going on and this, that, and the other. So you're asked by a lot of different people in the room, especially when it's an emergency room, right? Oftentimes I was driving Victor to the hospital. It wasn't like he went by an ambulance all the time, which did happen a couple times, but that also cost a lot of money. But it wasn't because of the money. It's just I knew I could get there. I knew all the tricks. Basically, I knew who to call to give a heads up to the emergency room, and also I just knew all the things that I needed to bring with me. So anyway, we're in the hospital X amount of days, and you get to a point where you're sleeping there. You're staying there. My husband and I would switch off. We would alternate days and nights and days. So you don't see your partner very much. Some families in the early days, we stayed at the hospital together until we realized we couldn't do that anymore. And it was often that I would be in the hospital during the day. So my husband could feel thunder. I'm telling the truth. So edit. So yeah, you get to a point where you're just kind of in this really weird groove. I would pack myself a lunch, ready to stay, and dinner, and stay for long periods of time. And then I would swap with my husband and until he needed to get some rest at home. And then, but you'd walk around casually in your pajamas, which for me was weird because I know today a lot of people can comfortably walk around in their pajamas, but that's not me. And so it was kind of like, oh, okay, I'm walking around. It's hard to sleep. I mean, I knew the drill. I'd bring a sleeping bag, my earplugs, an eye mask. I would tell the nurses, I'm checking out now.
That was your normal.
That was my normal. And it took many years for me to get to that, to understand this is what, it takes for me to get through and deal with all of this. But at any given moment, you have someone coming in the room. You don't have privacy. You don't get rest in any hospital because someone's always poking and prodding.
Right.
They're either drawing blood, they're changing a IV bag, they're coming in to check vitals, the doctors are doing their rounds, and so I always participated in when the doctor's rounds would happen. I would always have something to say. So there's a lot of crazy things. I will say that some hospitals are better than others in the amenities that they offer. There was a hospital we stayed at that had massage, so you could schedule yourself a massage while you're there. Cook Children's is amazing. It was amazing for us. I was able to access a hospital gym that was the hospital next to us, and get some exercise in. I did a lot of exercise, walking, I should say, when we were in Philadelphia. I walked around that city. It was great. I loved it. But it's very taxing. A lot of friends want to come visit, which is great. I think it's always nice to have someone let you know when they're gonna pop in.
Right.
Um, I had at the worst moment, when we found out that we had to go somewhere else with Victor, and I was definitely not in my right mind. 2 people had showed up that I wasn't expecting, and it was very kind and very nice, and, they were from the school, and, they had no idea, they just had no idea, and, um, I I I just had a hard time. It was really hard for
Oh,
me to have a visit. It was a very short visit. At first, I was like, "I can't do it." Like, I always said yes, but at that moment, I just was like, I can't do it." And,
mhm.
but I did. I did it anyway.
Yeah. But that's
Um,
a message to people who definitely that they care, but that's a good, a suggestion for them, always call because, yeah, they don't know at any given moment what's happening. So, yes.
well, and
So,
also,
folks, call first.
as yes, please call first or know when the visiting hours are. And
Yeah.
I got after so many different visits, I would eventually tell people when is a good time. It took me again, that takes figuring it out from experience. But
Mhm.
I would advise anybody who's going to visit someone in the hospital to let them know that you're coming,
Yes.
because you never know what's going on in that room, And thankfully,
Right.
Victor, especially well in the when Victor was in the ICU, he we were there. We went to every single space in the ICU. I mean, every space. I knew it like the back of my hand.
Wow.
And, you get to know the nurses really well. But anyway, I could say a lot of things about being in the hospital, but I don't wanna.
No, that's your experience. Now, there's another thing that happened, and you had touched on the nursing care and how that's a revolving door, but also a lot of times parents encounter issues with just childcare, finding the appropriate childcare for their medically fragile child. It's almost non-existent. Did you have that issue as well?
1000%, yes.
Mhm.
So, in the years when Victor was a baby and we didn't know what we were walking into, um, I I was able to go from full-time work to part-time, um, with the same employer, and they let me work from home. That was before people were doing hybrid and
Right.
regularly working from home. So, that was kind of a test case, and, I did that for a number of years. So, we found someone to come and help me during the
Mhm.
day, and that person ended up being with us for probably 6 years. She was like a grandmother to my child, just incredible. I just totally lucked out and met from the get-go,
Yeah.
like the best person. Um, we then relocated. She followed us along because we were still, in driving distance. And then I had my second child, and I was still planning to go to work. Um, so we hired an au pair. So we
Oh,
were very fortunate. Now, again, that's outside of Texas. I did not have the option. I just had to figure it out. There was no caregiving, or if you were you had the luxury of getting money to
mhm.
or funds through Medicaid. There were slim pickings, and it was really
Yeah.
hard to get an actual nurse or
Right.
assistant nurse. It was just basically a regular person, which I thought was always very odd. So I was grateful when we came to Texas that Victor was able to get actual nurses. So, but now keeping actual nurses actually took me a while to get to that point where I could even hire a nurse because we hadn't qualified yet. So I did the same thing I knew before, and I found someone that helped out, and he helped out here and there, and that was great. Um, but it was unreliable. Um,
Mhm.
Victor was able to go to school, and the school they had a nurse there, so that person would be with him.
Mhm.
But that nurse was through the district. And again, every school, well, you don't
Oh,
know, but every school district is very different in how they
right,
to handle that, if they will allow or they won't allow nurses. And
right.
our district at the time was not willing to have a private duty nurse go with him. Well, then things changed and they took a chance on us. And later, after going through this big process, we had probably 3 meetings with administration about us having a nurse. Um,
Wow.
where I had seen when Victor was younger, other people whose kids did qualify and they had a nurse, they were able to go to school with them. It wasn't a big deal.
Correct. Yeah, they will.
So I
Yeah.
also had to find a nurse, but but also someone who would be able to go to school with Victor. Now, in order for us to do that, we had to sign some contracts, all these different things, have the nursing agency work in unison with the school district.
Correct.
Um, and then it didn't become as much of an issue. They actually thanked me later. They actually said, I know that we weren't sure. They had just all these liability concerns.
Right.
And I said, we took the liability away. That's basically, we waived that because we had our own nurse with him. So that was a lot. Now, in order to keep nurses, I don't have a magic stick on how to tell somebody what to do about that. But it just comes with the whole deal. It's just, you meet nurses, sometimes they work out, sometimes they don't. Sometimes they come in. I've had nurses come in, they love Victor, this and that. Then Victor ends up in the hospital, and then they don't come back after he comes back in the hospital from the hospital, which is when I need them the most.
Right.
Uh,
Probably they've been probably reassigned, maybe, correct? I
right,
think that's,
right.
yeah.
Or they decide that they want to go. There's another person that lives closer to them, or something like that. I mean,
Yeah.
all understandable
Mhm.
situations, really.
Yeah.
Um, or just some nurses, we just were not a match, and I had to break it to them. But I went about trying to find people on my own, um, through the nurses. I said to the nursing agency, I don't think a lot of people do this. I would say, okay, rather than you just send me somebody, because they'll do that. They'll just send you someone for the day that you've never
Mhm.
met before. And Victor's care was so intense, that I said, no, 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 I'm wasting my time. You're sending me people. They don't know what to do. Even if I train them, they're not, whatever. It's just not working out. So I said, before I decide that I want you to send me anybody, I would like to meet with them over the phone. So I would
Okay.
do phone interviews, and then I ended up just doing FaceTime interviews. I want to see them. I want to talk with them, and right, like we're doing right now. And
Right,
that,
get that facial expression, see
yeah,
if they, yeah,
you want to
if
have a
they're
connection,
in it.
right? And
Yeah.
it's not, when you have someone coming in your home, um, you want to be able to get along with them as much as you want them to be professional and know what they're doing for your child or
Right.
your loved one, right?
Mhm.
They're in my home. so
Yeah.
I needed to have that connection, and luckily I was able to find really great people over the years. Some came and went for whatever reason, having a baby or whatever.
Yeah.
And I was lucky, and although it took me years and years to get a full team. Now, Victor, he was bumped up from that 30 hours a week, or whatever, how many hours a week it was. When he came home from Philadelphia, he came home on hospice, and then he qualified for 24/7 nurse care, which was amazing. But again, I was still always training people, interviewing people, that kind of thing. So it was a
Mm.
job in itself, just finding a nurse.
Right.
Um,
Yeah, here you are going through, the the impending loss and the stress that's associated with that, but still you have to navigate the nursing system. Yeah.
yes, and when
I
we
cannot imagine. I
oh, no,
cannot.
you can't. Nobody can. I wouldn't be able to have imagined. Um, the day I came home with Victor from that long hospital stay and on hospice, I walked into, I don't even know, maybe 7 people were there. I mean, it took us a long time to discharge, and then I was able to regain one of our great nurses. She came back to us. I was so excited. So she was with me in the van, and we walked in, and there were just like literally a line of people. And I was up until, I don't know, 1 in the morning or something, just filling out information and stuff because he went into hospice. So there was all that. And then there was someone to help us learn how to use some of new equipment that we didn't know about. I mean, it was a lot. Yeah.
Goodness.
Yes. Now this happens, to a lot of people every
This
day,
is,
all the
it's real
time.
life.
I mean, I think about this now because Medicaid is so fragile. Healthcare is so fragile at this point in our lives for everybody. I just know how hard it is for the families. I just know it.
Yeah.
It's very stressful. So yeah, I think those of us who are in this place, or if starting out, I've reached out to people who I knew were a woman, for example, nearby was in a car accident with her baby. And when I heard about it, I just immediately give me her. I need to connect with her. And I showed up and I talked with her and I just said, here's a meal. And when you're ready, contact me and I will help you. So I had, in term back to the advocacy part, I advocated for others also in the way of just trying to educate them, other parents, other caregivers who were new. And so from the different hospitals, they'd ask me, could you be someone that we could have people call? And I said, yes, of course. So I always took that on because it took me so long to understand so many things. I thought, geez, if you've got some intense situation with your child, I'd love to be able to cut through some of that and just be able to get you a little bit further along.
Yeah, that is so important because, just your average person doesn't know. They're not in those shoes. So if a family can go and speak to somebody who's walked this road, I
Mhm.
mean, it's valuable because you know exactly what they're dealing with. So I would
Mhm.
love it if, there was like a program other than say, would you happen to know somebody? It would be great
Mhm.
if they had a program where you have parents on the ready to be able to meet with some of these parents who kind of guiding them through the process.
I keep
So
thinking I should do that. And I try to figure out how do I do
yeah,
that, because yeah. On
yeah,
a regular basis, like as a job would be nice, but
yeah. Right, yeah. I mean, you're an expert. Nobody
Mhm.
knows, nobody can go through, no nurse, no doctor, no teacher can go through what you've gone through. So yes, you are
Mhm.
the expert in that field. So yeah.
Mhm.
Yeah, if there's something, wow, that would be great. Maybe a nonprofit, start a nonprofit.
I know, I know. Yeah. I think it's good.
Something to think about. What so so you also did one other thing. You ran for Tarrant County Commissioner in 2024.
Crazy.
Um, was the journey with Victor or the experience that you had with Victor and it a motivating factor in that run?
Absolutely. I carried him with me. I still do, of course, but through that journey.
Mhm.
In fact, the colors, I don't know if I told you this, Gwen, the colors of my campaign were the colors of his equipment. So like
Oh, I didn't know.
the green that my colors were blue and green, and he looked really great in this kind of like neon green color. So
Uh-huh.
he definitely had influence on my campaign. But
Mhm.
yes, definitely, I had many different reasons that I decided to run. And one of them was after I was looking at the different profiles of the current commissioners at the time, I was so impressed with the number of things listed under former Commissioner Brooks, under his profile on the website, and he has done. I hadn't known any of the other commissioners, so I just wanted to learn, obviously, about it. And when I saw this long list of different organizations that he had connected with and had part in, and I just thought, wow, that would be so great if I could help in some way as a commissioner lift up some of these organizations that are actually doing all the things that I think are the right things for real people that are in need. So that definitely comes through Victor, right? So yes, absolutely.
No, that's that. Yeah, I did not know that story about the
Mm,
colors, so that's
mhm.
adds another layer to that. Yeah, to
Yes,
that run.
yeah.
So all that being said, in what would be the ideal system for parent? What would you like to leave parents with? Like, what would you like? What services would be ideal for parents that are going to be going through the same thing or are currently
Mhm.
going through the same thing? What's an
I think
ideal world look like? An
I
ideal
think you
Texas?
described some of it already, right?
Yeah. Mhm.
One, to not have to worry about paying the high medical costs. I would like, for families to not have that be a worry.
Right.
It literally was hanging around my neck every single day, and in every aspect. It was, I mean, as Victor aged, it was so hard because it's any mom, regardless, right? You're just like, oh my gosh, they're this old already, right? But he
Right.
was getting
And
closer and closer.
that
Aged
21.
out. Yeah.
Yeah.
And so I kept thinking, oh my God, like birthdays were fun, but they were also bittersweet. And it shouldn't be like that.
Yeah.
So the ideal would be that no parent has to experience that because it's awful. It's awful. If I could have a wand that we would have universal health care, of course. It would be high quality. Um, you wouldn't have to jump through so many different hoops in order to get the care that your loving family member needs. Um, and maybe part of it would include a, a parent advocate, right?
Mm.
That could come to your home, could do
Mm.
those things that I figured out how to do. Uh, and I know that there are social workers, there are a lot of things that hospital systems offer when you are inpatient. He could get some therapy when he was inpatient, right?
Oh, okay.
So there's also school. People don't know that. I didn't know that for the longest time, that the many times we were in hospital, I could have had him
Oh,
educated.
homebound.
No, in the
Oh.
hospital.
Oh, in the hospital. Oh, yeah, because yeah, when kiddos are in the hospital, you have the services go to them. I think,
That's right.
yeah, they even
Yes,
have, yeah.
that's
I know
right.
Cooks has that set up. Yeah.
Yes, they do, and I didn't know about that for many years,
Mhm.
which I find interesting because nobody mentioned it to me. I kinda stumbled across it, and then when we went to I'm backing a bit, but when we went back to Philadelphia, um, I knew about it, and then I fought really hard to get it, but the system here had to allow it to happen there.
So
And
that was another hurdle.
yeah, and he
Uh,
couldn't get it. He couldn't get it.
mm,
Um, that was very frustrating. So again, my ideal to summarize would be no worry about money, focus on your kid, focus on the rest of your family, do what you need to do, right? If you need time off, your job's not going to let you go because of it. I think it would be great if it could fall in somehow, just like, maternity leave, hospital leave, right?
mm,
If businesses could be open to that, or should be, in my opinion,
mhm.
and that it wouldn't be so difficult for families to get also the equipment that they need. and the supplies that are necessary for their child to have.
The training.
Right. Like I will tell you this, there are things like, yeah, training for sure. But there's, in terms of like supplies, there are things that like you can only get so many catheters a month. you know, like, like suction catheters. My son needed to be,
Okay.
and so
Yeah.
it was just like, really? So I'd be really stingy, it's just like, I mean, you'd find yourself doing
Yeah.
all things. But I hope that's clear that's
No, it's very clear. It's very clear.
and
And
my hope would be,
having the advocate.
yeah, having an advocate, and the parents not having to pay extra for the advocate, because there are advocates out there, but they're doing it on their own. They're getting paid through families generally, I think.
Okay.
Yeah. So
Yeah. So there's a lot there. There's much has been done, but there is definitely a lot more work to do.
a lot to do. Yeah.
um,
I mean, I could talk all day long about a lot of different things, so I'm not going to take advantage of that right now.
okay.
But healthcare is such an important issue for every single person. I will never be able to understand why it's the haves and the have-nots that can get access to healthcare, and I don't care where you come from. You're dying, you need surgery, you need all these things. Absolutely, this should not be something that people have to worry about. And the only way for us to ever get to that point is for people to vote, and not just vote, but pay attention to who the legislators are. And it's not that hard. I know a lot of people. I would say to people, I've had public speeches before, and I've always said, if I could figure out how to do this with all that I've got going on, you can figure it out if you don't have any of this going on. It is important for each of us, our family members, know who our legislators are, contact them with your issues. That's something I definitely did along the way with Victor, is I'd say, hey, this is what's going on with my family right now. What can you do? Do you know about any of these things? And I think that is really what it comes down to. Just like everything else, we are all affected by who is leading our country, who is leading our state, who is leading our city councils, everything. And it all is related. So I know we align with that thought. And so I'm preaching to the choir, but just can't emphasize that enough.
Right. Yeah. But a lot of times people do not know where their representative or the person on their ballot stands on healthcare and where they're at. Yeah. Like, say, here in the state of Texas, where we don't even expand Medicaid.
That's right. There's a handy tool that's out now, that's been out for a while, and it's called ChatGPT and AI. And you can plug in anything you want and ask. I did some of that before we had this conversation, just because I was curious about Russia. And you can just talk to ChatGPT like you're talking to a person, and just put in whatever it is that you want to learn. If you want to know who is your representative, I haven't done that yet myself, but I can guarantee you can try ChatGPT, or there's this other one that I just started playing with called Perplexity AI.
More AI, yeah.
And
so it's not just for editing a paper.
No, there's a big world of things you can learn in there. So if you don't know, it's better than Google. It'll give you some very fast information.
Great. Well,
we'll plug for
maybe
AI
you need
there.
to build maybe the ChatGPT AI agent might be your future advocacy, building a program as far as that. So you do plan to you do plan to continue your advocacy, correct?
As much as I can.
Right.
Yes.
That's great. Well, thank you so much, Laura, for coming on with us. It has been very informative, and I'm sure a lot of folks who did not know what this looks like when you have a medically fragile family member, they get a clearer understanding of that.
Yes. Thank you.
Thank you.
Happy to share.
Thanks. Thanks again, Laura, for coming on.
All right.